How to survive a heart attack if you're alone. According to the Centers for Disease Control and Prevention CDC, 85,000 heart attacks happen in the United States each year. The scary thing is that heart attacks don't pick a time or place. They can happen in your car, at work, at a store, or even at home. Imagine being alone in that critical moment with no one to reach you. Every second counts, and it could be the difference between life and death. But don't worry, in this video we'll show you simple, practical steps that can improve your chances of survival if you're alone and having a heart attack. Stay tuned until the end, like and share this video. This information could save lives, maybe even yours. Heart disease doesn't take a break. In fact, it's the leading cause of death worldwide, and the numbers don't lie. According to the American Heart Association, 1 in 5 deaths in the United States is related to heart disease. A heart attack, also known as a myocardial infarction, occurs when blood flow to the heart is blocked, usually due to a clot in a coronary artery. Without oxygen, the heart muscle begins to die quickly, and every minute counts. In these moments, speed is the difference between life and death. Ideally, immediate help would be available, but the reality is often different. A heart attack can happen anywhere, anytime, and what if no one is around at that critical moment? Information becomes your best friend. Have you ever had a heart attack when you were alone? What steps did you take? Leave your comment below. 1. Recognize the symptoms immediately. The first step to coping with a heart attack alone is learning to recognize its signs. Although the most classic symptom is severe chest pain described as pressure, squeezing, or burning, a heart attack does not always present this way. It is important to watch for chest pain or pressure that lasts more than a few minutes and that may radiate to the left arm, back, neck, jaw, or abdomen. Other symptoms include shortness of breath even at rest, cold, clammy sweat, dizziness, nausea or vomiting, extreme weakness, a feeling of faintness or unexplained anxiety, pale or gray skin, or a feeling of impending doom. In the United States, an estimated 200,000 heart attacks a year occur in people who have already had one. Early recognition can prevent more serious heart damage. Don't write off mild symptoms as just discomfort. If you suspect you are having a heart attack, don't remain in denial. The sooner you recognize the seriousness of the situation, the sooner you can act. 2. Call emergency services immediately. Even if you are alone, modern technology is a powerful resource. Call 911 for emergency assistance. Explain clearly that you think you are having a heart attack and, if possible, provide your address or approximate location. Put the call on speakerphone so you can follow the dispatcher's instructions hands-free. Do not attempt to drive to the hospital on your own. You could pass out while driving, cause an accident, and endanger yourself and others. Time is critical. Every minute without proper medical care increases the damage to your heart. 3. Sit or lie down in a comfortable position. Find a safe, comfortable place. If you are standing, sit or lie down with your head and upper body slightly elevated using pillows or leaning against a wall. This position helps improve breathing and reduces the strain on your heart. The less energy your body uses, the better. 4. If aspirin is available, take it. Aspirin is a mild blood thinner that can help prevent large or new blood clots, potentially reducing heart damage. Many health professionals recommend chewing a regular aspirin tablet, about 300 milligrams, if you suspect a heart attack, as it is absorbed more quickly through the lining of your mouth. However, only do this if you are not allergic to aspirin and have been previously advised by your doctor to take it in such situations. If you are unsure, your first priority should always be to call 911 first. If aspirin is not available, do not put yourself in danger by searching for it in hard-to-reach places. Avoid unnecessary effort. Your safety comes first. Staying calm is a huge task when your heart is hurting and you're alone, but panicking increases your heart rate and blood pressure, which is exactly what you want to avoid during a heart attack. Try to breathe slowly and deeply. Inhale through your nose, count to 3, and exhale through your mouth. The American Heart Association emphasizes the importance of self-control during these moments. Simple mental relaxation techniques, such as focusing on a still point in your surroundings or mentally repeating a calming word, can be helpful. Reducing internal stress will help your body use less oxygen, easing the strain on your heart. 6. Avoid unnecessary effort. This may seem obvious, but it's worth emphasizing. Don't try to stand up to reach for distant objects, climb stairs, or do any activity that increases physical exertion. Every extra movement requires more oxygen and energy from your already weakened heart. Stay as calm as possible in a comfortable position while waiting for help. If you are in a dangerous place, like the shower or outside in the yard, move slowly to a safer place, but do so with minimal effort. Your priority is to conserve energy and reduce the strain on your heart. 7. Loosen tight clothing if possible. Anything that restricts your breathing or circulation should be removed. Loosen ties, collars, belts, and tight bras. The less restrictive you are, the better for your breathing and blood flow. This is a simple step that is often overlooked. By improving comfort, you reduce the feeling of suffocation, help you stay calm, and allow oxygen to flow better into your body. 8. Do not eat or drink anything during a heart attack. Avoid eating or drinking anything unless you are specifically instructed to do so by emergency personnel. Drinking water or eating anything can increase the risk of choking. If you start to feel nauseous or start vomiting, the fewer variables you introduce into the situation, the better. Your priority is to remain conscious, breathe normally, and wait for an ambulance or medical assistance to arrive. 9. Monitor your symptoms and stay conscious. If you are conscious, try to watch your symptoms progress. Is the pain getting worse? Is it moving to another area? Do you feel a loss of sensation in an extremity? While it may be difficult to concentrate at this point, any information you can provide will be valuable to the medical team when they arrive. Staying conscious is also important. If you feel like you are about to pass out, try to position yourself in a way that minimizes the risk of falling or injury. Remember, your safety is paramount. 10. Plan for the future. This step is not for the moment of the attack itself, but to help you avoid a similar situation in the future. Understanding your risk factors is critical. According to the CDC, in the United States, factors such as high blood pressure, high cholesterol, diabetes, smoking, physical inactivity, and obesity significantly increased the chances of having a heart attack. If you fall into any of these categories, talk to your doctor about what to do in an emergency. Always keep your phone charged, know the shortest routes to the nearest hospitals, and let your friends and family know about your condition. Some people keep aspirin or prescription medications in easy-to-reach places in case they need to take them quickly. Taking care of your heart goes beyond the moment of an attack. Regular checkups, a balanced diet, moderate exercise, cutting down on alcohol, and quitting smoking are crucial. Small lifestyle changes can help prevent serious problems in the future. Aside from knowing what to do during a heart attack, prevention is always the best choice. There are many initiatives in the US aimed at raising awareness of healthy habits such as maintaining a balanced diet, weight control, reducing the intake of salt, sugar, and saturated fat, and, of course, regular exercise. All of these help keep arteries clear, reducing the risk of fatty plaque and blood clots. The American Heart Association recommends at least 150 minutes of moderate physical activity per week, as well as a diet rich in fruits, vegetables, whole grains, and lean protein. In addition, stress management and getting good quality sleep also play an important role in heart health. Another important point is to recognize warning signs. If you notice something unusual in your body, such as unusual fatigue, a racing heart, or chest pain, do not ignore it. The sooner problems such as high blood pressure and high cholesterol are addressed, the lower your risk of experiencing a heart attack alone. Remember that these recommendations are not a substitute for immediate medical attention. If you are having a heart attack, seek help as soon as possible. Now we want to hear from you. Have you already tried these tips? Do you have other tips or experiences you would like to share? Leave your comment below and help others be better prepared. Information saves lives. If you found this video helpful, please leave a yes in the comments below. I also recommend you watch these 2 videos we've put together just for you. Thanks for watching.